But if you need other services like diabetes education, smoke cessation programs, if you're suffering if you've had a stroke or a heart attack, then we'll have the exercise programs for that rehab group. The programs that don't currently exist in Cornwall, that's what we're looking to put in place, not duplicate what our partners currently have. And we'll go to the experts in our community and ask them to deliver what their mandate is and refer back and forth. That's why we're here, is to fill the gaps. We have a large population of seniors, we have a large population of under-resourced population of low-income individuals and families, and a new population of newcomers to Canada, and we want to be able to serve them so that they maintain good health and have access to full benefit of quality health care and resources in our community. And we can help them access these services. As an example, if someone comes here from another country, and I've already had the experience where they thought they were well in a big sweater for the winter, not understanding our Canadian winters, or our community health worker now will go with that family to the snowsuit fund, to the Agape Centre, to other resources, to other organizations who provide housing and may help them with retraining or education, employment. So we have workers that will actually help people find and access those resources in our community and make them work for them before their health deteriorates. When people come here from other cultures, it doesn't take long before they are overwhelmed. We're here to help them not become overwhelmed and maintain good health. Likewise, seniors, a lot of seniors in the community, if they're alone, finding themselves alone in their lives, we'll have cooking classes for widows who are alone now, teaching them how to cook for themselves. We'll have programs for maybe young parents who are single parents who need help learning how to cook on a limited budget, learning how to cook from scratch, support groups to help one another in our community. So that's what's different about our model. It's about looking at what people who come through the door, what they need, and pulling that resource together.
Looking at the people that come through the door, there might be a misnomer in here that this is a walk-in clinic.
It is not a walk-in clinic. If you're going to see the physicians, nurse practitioners, or the nurses, you have to be a registered client. In another environment, that would be a registered patient. If you want to use any of our other community services, like the dietitian, the social worker, the community health worker, the health promoter, you do not have to be a registered patient. You can come, you will register so that we know who you are and that you're using our services. Anyone can access all of those other services.
Are there fees for services like dietitians?
No, there are no fees. You have to schedule an appointment because we can't just have walk-in for that either, but we will serve those needs.
Do you have to fall under one of those groups, being a low income or being a minority?
No, you don't. Anyone without access to health care can come here. Anyone who's, for instance, the diabetes education, you or I could come to that education. It's about prevention and health promotion and maintenance. That's accessible to everyone. The difference here is we'll target specific programs that will naturally draw those priority populations. We'll look to finding, like seniors and the Arthritis Center, a society that's working here. We know most seniors have arthritis, so we welcome the Arthritis Society having their service here. And that way we'll meet our priority populations, our target groups.
How many people do you have in here right now working there?
Right now we're 12 full staff and 4 contract. And we will be 20 when we're fully staffed. I have room for 4 physicians. I currently have 1 recruited. I'm looking for more physicians. I have room for another nurse practitioner. I'm looking to hire a dietitian. And well, there'll be other positions as we go forward. But those are the
what services currently are ready to go?
Well, we just opened last week. So our primary health care, since the day we opened the doors, people are receiving the physician, the nurse practitioner, nurses services. Our social work is already seeing clients. And our other programs, you'll see them on the board. They're posted, people can register. Next week we start a welcome program, inviting people to come in and learn about who we are, have coffee with us, meet and greet. A walking program for HealthWise program. It's called Health Heart program. We'll have exercise programs for seniors, for those people who have just had a heart attack or a stroke. Those exercise programs that are monitored by a nurse so that you don't overexert. So there's a whole wealth of programs that we're asking people to sign up for, and as soon as we have a few registered, we're ready to start. Another one is scooter safety. We see there's a lot of scooters in the community, and we don't know if anyone's had an opportunity for them to meet and talk about road safety and dressing properly well on them and using the seat belts and those, what do you call those vests that are, that you can see in the dark? Reflective vests, and maintenance of your scooter and so on. And we also think that population might benefit a great deal from some of our other services that we have to offer. So by bringing them in, they'll see what we have, and they may even just be a support group for each other, but it's an opportunity for people to improve their health and social experience.
Do you mentioned this? What vacancies you still have there? Dietitian?
Dietitian, 3 physicians, and another nurse. Well, they'll be posted in the paper. The positions are posted now.
They're posted now? How long? They haven't been posted very long then?
Oh, they've been posted all along. I think across Ontario there's a challenge to recruit physicians, and people have a very specific interest in working either in a community health centre or in a hospital emergency or a specialty program. So they're looking to fill what their primary interests are. And I'm finding that people who come to Cornwall have been here before, coming back to Cornwall, so that's good.
You've explained a lot about the sort of the services that you offer as far as clinics and things. Can you explain a little more about the primary care that you offer, the people that are sick that come to your door?
Sure. Primary care is what you would see in a clinic.